March 2020 saw a radical departure from normal life in the UK. The COVID-19 outbreak means new restrictions are placed on dentistry. Chancellor Rishi Sunak pledges furloughing, loans and cash grants. We demand financial support for dentistry, NHS and private. As practices reduce face-to-face care and begin remote triaging, our members are stressed, confused and anxious for guidance. We respond. We create a live COVID news feed on our website, covering the latest news from England, Wales, Scotland and Northern Ireland. 7,000 of you visit it daily, resulting in 3 million visits to date. You call our advice team around the clock. We take 5 times as many calls as we had previously and answer 9,000 emails. 8,000 of you tune in every Friday evening to hear the latest news and updates from our CEO, Martin Woodrow. It is the most challenging time. By the Easter weekend, the COVID death toll surpasses 10,000. Urgent dental care centres are set up across the UK, but PPE shortages result in delays. We petition the government and fight for your safety. As more dental teams are furloughed, redeployed or shielding, we create the tools that you tell us you need. And when associates report that they aren't being paid as directed, we launch a pay dispute service and review 500 cases. Changes are rapid and dentists feel forgotten, so we shout even louder. 1,600 members and 101 MPs join us in calling for fair and equitable support for private, self-employed and mixed practices. The pressure is on the Treasury to step up. As lockdown progresses, you discover that your insurers won't cover you. We take up the case and get the lawyers involved. Dental practices start to reopen in England and expansion of care resumes across the UK. But PPE, cash flow and childcare make it difficult. We make headlines across the UK media and voicing your concerns. With a record number of new members joining up, we create more webinars and CPD courses and launch new toolkits to help you return safely and confidently to face-to-face care. As many dental teams resume work, we see further progress in response to our rigorous campaigning in England, in Scotland, in Northern Ireland, and in Wales. Fallow time, capacity and patient expectations are causing undue stress. We witness the highest usage to date of the counselling and emotional support service Health Assured. We reach out and ask how you are doing. You tell us, and trust us to be your voice. We don't let you down. We take your case to the top. We present evidence to health committees across the UK, and Jeremy Hunt promises to reopen the inquiry into dentistry. As the struggle with fallow time continues, we contribute to a rapid review into AGPs. Its recommendations influence revised standard operating procedures across the UK and make it possible to bring fallow time down. Capacity remains a crippling issue for practices. Tens of millions of dental appointments have been missed across the UK since the first lockdown, and access is still at crisis point. We call on the government to provide urgent investment to help you upgrade your practice, improve ventilation, increase capacity and restore access for patients across the UK. Unfortunately, for dentists in England, there is more bad news to come. Dentists will have to achieve 45% of pre-pandemic activity to avoid steep penalties, according to the proposed UDA targets for the fourth quarter of the financial year. These targets threaten viability, undermine patient care, and are in stark contrast to the rest of the UK. NHS England should share this news, but instead it comes from us, along with essential advice and support. Some days later, a more transmissible COVID strain is confirmed, and the number of cases across the UK continue to soar. The PM announces a dramatic tightening of restrictions. We urge the NHS to reconsider the targets. Instead, they confirm them. We secure a debate in Parliament and ask you to write to your MPs. We remain the first dental organisation that government and ministers will liaise with. We represent you when and where it matters. We made it this far because we united as a profession. In the words of our chair, Eddie Crouch,
we all continue to rise to the challenges of lockdown, refocusing our efforts in the face of a unique threat. As a community, we must mobilise to meet those challenges head on.